Today we're going to talk about Valium. Valium is the prescription name for the generic of diazepam. And we're going to go over a lot of information that tells us what it is, uh, how it should be taken, what side effects, etc. So let's get started. So some of the most important information about Valium, diazepam. So they're tablets, and they are in the benzodiazepam medicine family. If you take this particular uh, drug with opioid medicines, alcohol, or other central nervous depressants, like Lexapro or Cymbalta, street drugs, can cause extreme drowsiness and potential breathing problems, which is called respiratory depression. It can also cause coma or death, and get help, get emergency help right away if any of the following happen: shallow or slow breathing, the breathing stops, which may lead to the heart stopping; excessive sleepiness, otherwise called sedation. We don't want to operate or drive heavy machinery until we know how we're going to be affected by taking this Valium. There is a risk of abuse, misuse, and addiction. Um, it is possible, and it can lead to an overdose and serious side effects, including coma and death. So we got to watch out for that. Uh, People have gone into a coma and passed away from this. So let's keep this in mind. And there's also some other serious side effects that could also include delirium, paranoia, suicidal thoughts and actions, seizures, difficulty breathing. And we want to call our healthcare provider or go to the nearest hospital emergency room right away if you get any of these particular serious side effects. You can actually develop an addiction even if you are taking the Valium diazepam tablets exactly as prescribed by your healthcare provider. We don't want to share these with others, and we want to keep this diazepam Valium tablets in a safe place and away from children. There could be physical dependence and withdrawal reactions that could actually happen as well. So we don't want to just stop taking this particular tablet because it can cause some life-threatening side effects, unusual movements, responses, or expressions, seizures, sudden and severe mental or nervous system changes, depression, seeing or hearing things uh, that others do not see or hear, an increase in activity or talking, losing touch with reality, suicidal thoughts and actions. Again, call your healthcare provider if these do present themselves and go to the nearest emergency room. Some people who suddenly stop taking Valium or other benzodiazepines have symptoms. They can last for several weeks to more than 12 months. Now, this can include anxiety, trouble remembering, learning, or concentrating, depression, problems sleeping, feeling like insects are crawling under our skin, weakness, shaking, muscle twitching, burning, or prickly feeling in our hands, arms, legs, or feet, or ringing in our ears. Physical dependence is not the same as drug addiction, so keep that separate. The healthcare provider can tell us more about those differences between the physical dependence and drug addiction, and we don't want to take any more of this than prescribed or for longer than prescribed. So, what is Valium diazepam tablets? They're used to treat anxiety disorders for the short-term relief of symptoms of anxiety, to relieve symptoms of alcohol withdrawal, including agitation, shakiness, or tremor, sudden and severe mental or nervous system changes, delirium, and seeing or hearing things that others don't see or hear, along with medicines for the relief of muscle spasms and to treat seizure disorders. They are considered a federally controlled substance because it contains diazepam that can be abused or lead to dependence. Again, keep this in a safe place away from children. Selling or giving away diazepam Valium tablets may harm others, and it's against the law. So, key to learn there. And we want to tell our healthcare provider if we have abused or been dependent on alcohol, prescription medicines, or street drugs. It's not known if these tablets are safe and effective in children under 6 months of age, nor or if they are safe and effective for use for longer than 4 months. We don't want to take these if we're allergic to any of the ingredients. And so we want to talk to our healthcare provider about that. And we don't also want to take it if we have severe liver problem, have a disease that can cause muscle weakness called myasthenia gravis. So tough word to put out there. Also, if we have a sleep problem called sleep apnea syndrome, we don't want to take this particular this medicine. Before we do take these, we want to tell all our medical conditions to our healthcare provider, such as if we have had depression, mood problems, suicidal thoughts or behavior, lung disease or breathing problems, have liver or kidney problems, are pregnant or plan to become pregnant. If we take these late in pregnancy, it could cause our baby to have symptoms of sedation, which are breathing problems, sluggishness, low muscle tone, and or withdrawal symptoms like jitterness, irritability, restlessness, shaking, excessive crying, and feeding problems. Again, tell your healthcare provider if any of these are pertinent to you. Also, if you are breastfeeding or plan to breastfeed, because diazepam, Valium does pass into the breast milk. Again, talk to our healthcare provider, any questions, any of this comes up. And breastfeeding is not recommended during the treatment using Valium/diazepam tablets. We want to tell our healthcare provider about all the medicines we take. So even including vitamins, herbal supplements, etc. We want to take them exactly how our healthcare provider has prescribed them. They'll tell us how many to take, when to take them. If you take too many, we want to call our healthcare provider, go to the nearest emergency hospital room right away. So what are the possible side effects? So seizures can cause us to make us sleepy, dizzy, can slow our thinking and motor skills. We don't want to drive or operate heavy machinery or other dangerous activities till we know how they affect us. We don't want to drink alcohol or take any other drugs that make us sleepy, dizzy while taking this without first talking to our healthcare provider. When taken with alcohol or drugs that cause sleepiness or dizziness, diazepam/Valium tablets, they make your sleepiness or dizziness much worse. And like other anti-epileptic drugs, diazepam may cause suicidal thoughts or actions in a very small number of people, about 1 in 500. Call your healthcare provider if you have any questions, anything like thoughts of suicide or dying, new or worse depression, feeling agitated or restless, new or worse anxiety or irritability, new or worse panic attacks, acting on dangerous impulses. So we can pay attention for these changes, and if we know somebody that is taking this particular drug, we can be on the lookout. The most common side effects are drowsiness, muscle weakness, fatigue, loss of body control, body movement,